Hey everyone. So in this video, I'm going to talk about REM sleep behavior disorder. So as from the name, you may infer that the disease has something to do during REM sleep. And why that's important is because let's look at the normal pathology, or not pathology, the normal physiology of how your REM sleep works. So we know that when you have your REM sleep, right, your pathways that activate motor activity are inhibited, which leads to a condition known as atonia, which everybody has. It's basically temporary paralysis. And you can see here, there's basically, this is a very specific neural circuit pathways, which you don't need to know, but I just thought it was really interesting. You can see here how the excitatory glutaminergic neurons are going to activate these spinal circuits, which stop the motor activity from going down, which stops you from acting out your dreams. So this circuit stops you from acting your dreams. And so now what happens if by chance this system doesn't work? So in that case, see how this glutaminergic neurons, they're only activated when you have activity while dreaming, but say this doesn't get activated. If it doesn't get activated, then these inhibitory neurons will never get activated. And that would mean that quite literally, even though your body and brain knows you're in REM sleep, this excitatory system is not activated, which means that you're going to act out your dreams. So this is actually, as scary as it sounds, something that happens for people with neurodegenerative disorders. You're going to be hearing this term a lot from this point onwards. So, neurodegenerative disorder. Neuro. Okay, sorry, I don't know how to spell, guys. There we go. Disorders, which is basically when your neurons degenerate, right? Neurons, for simplification purposes, I'll say die, right? And as you can tell, if the neurons that are in your brain die, or that would mean that you have decreased cognitive function. And REM sleep behavior disorder is very special in the sense that it's seen a lot with patients with Parkinson's disease. And Parkinson's is very special because it affects a region of your brain known as the substantia nigra, and degeneration of this area causes uncontrollable movement, right? Uncontrolled movement, which is something we see known as tremor. So it makes sense that this disease, or brain disorder, I should say, is seen a lot in patients with Parkinson's. So how do we treat a disorder like this? Well, I believe in like 1 to 2 chapters after homeostasis, we're going to be talking about drugs and mental disorders and drugs and all of that. And in that, you have a class of drug known as benzodiazepine. And benzodiazepines are known for their inhibitory effect. And they're usually used to calm down people, calm them down. So they can be used in bipolar disorder. I've heard of cases where people use them in anxiety disorder, things like that. So you can understand why, for REM sleep behavior disorder, you'd use something such as a benzodiazepine. For example, the main drug used for REM sleep disorder is known as clonazepam. And clonazepam enhances the effects of GABA, which is the main inhibitory neuron, right? And by causing the effects of GABA to be enhanced, what that does is that you are going to basically cause this inhibitory effect that you see here to be enhanced. So see how it's kind of sparse here? It's going to be reinforced. So people don't act out their disease. So now let's talk about why this disease is so bad, right? Well, first of all, when you're asleep and you act out your dreams, you could potentially hurt yourself, right? Because you're not conscious of your movement. It's bad because you can hurt yourself. And to add on to that, you are actively interrupting your REM sleep. REM sleep by acting out your dreams, which means you're not getting enough sleep. And by not getting enough sleep, that contributes to daytime sleepiness, as we talked about in the last video. Please watch that if you haven't watched it. It's really helpful to understand what daytime sleepiness is. And that would cause a lot of adverse effects, such as interruptions in driving, not giving your full attention, so on and so forth. So that's my video on REM sleep behavior disorder. And now after this, it's just narcolepsy, and we'll be moving into the states of arousal. So thank you so much for watching, everyone. And I wish you the best of luck in your preparation for Brain Bee. Bye.